Hi everyone, my name is Lauren Sue,
And my name is Roma Panchal.
and we are seniors at Torrey Pines High School. We are here to deliver a very important message about the opioid epidemic. Before we start, I would like every person in this room to look around you and find 7 friends or classmates sitting near you. Now look at just one of those 7. What if I told you that 1 in 7 teens abuses prescribed opioids? What if that one person you are looking at could potentially be exposed to a life-threatening drug? Well, I'm here to tell you that our reality will be different because by the end of this presentation, you will all be proud to pledge to a clean teen lifestyle.
So let's dive deeper into this problem. Does anyone here think they know what opioids are? Well, opioids are a class of drugs, and certain opioids are considered some of the most deadly drugs in the world. Now, you may have heard of a few types of opioids, like morphine, fentanyl, and heroin.
Today, we are going to be talking about prescription opioids like fentanyl. Prescribed opioids are actually often given as treatment by doctors for severe pain. Opioid use is a common medical treatment for pain because they are the most powerful medications that exist for pain. Opioids are important for patients suffering from extreme pains like cancer, surgeries, or even childbirth. So you may be wondering, what could be so bad about this? Well, let's look into how they work. Opioids block areas of the brain that control pain and emotions. In this process, they stop pain messages from reaching the brain. When opioids block these pain messages, it overflows your brain with dopamine. Dopamine is a natural hormone that your body makes that causes you to feel relaxed and happy. This can help relieve patients, but it can also present a huge risk and be potentially life-threatening.
Now, this is life-threatening because opioids are insanely addictive. Similar to the happiness and addiction that you feel after scrolling on TikTok, opioids can become toxic because of how relieving they can be. Think of it like this. An opioid is a dangerous substance that disguises itself as a friend. It's like an imposter out to destroy you. So, what does this mean for your mind? Well, after your body experiences this extreme happiness, it will become addicted to the drug and crave more.
When a person is addicted to a drug, their brain gets hijacked. The first system that gets hijacked is the reward system. This is the system that's involved in helping us think about what's important and what motivates us to do things. It's what motivates us to eat, to drink, and to do important work. When that system gets disrupted, the addiction tricks people into thinking that the drug is more important than anything else, even family and friendships. You see that people focus all of their attention and energy during the day thinking about the drug or trying to get the drug.
The addiction also damages the ability to make decisions. When we see people suffering from drug addiction, getting in trouble at school, committing crimes, losing relationships with family and friends, the part of their brain that decides whether or not the consequences of their actions are bad are actually not working correctly. And so, like how a person with a broken leg is not able to run, a person with this part of the brain that is dysfunctional is not able to make good decisions. And this is why addiction is a disease of the brain.
While addiction can be a mental disease, it can really quickly become a physical disease that can harm your body. So, what does this disease look like in real life? While people can develop super high tolerances for drugs, there is always a breaking point for your body. The worst part about this breaking point is that you never see it coming. When you finally overdose and take a dosage that is just too much for your body to handle, your body starts to break down immediately.
You're probably wondering how many of these people got access to these drugs if they're so dangerous and addictive. Now, one way, as we discussed earlier, is by being prescribed opioids for pain relief and then becoming dependent upon them. It's important for everyone to understand that people who suffer from addiction were not trying to become addicted, and at some point, their brain has lost control. Another way people get access is through self medication. There are prescription opioids in many people's medicine cabinets, maybe because their family members had a prescription. So they start with the medication from the medicine cabinet and they like how it feels. They like how it temporarily relieves them from any kind of severe pain or stress that they have in their lives. But what they don't know is how quickly you can become physically dependent of an opioid.
It is only a matter of a few short weeks before they're relying on the opioid to make them feel normal. When their prescription supply runs out, they turn to illegally sold opioids. We want to be clear. Prescription opioids are designed to help people and give you dosages in the correct amounts for your body. When you turn to illegal opioids sold from drug dealers, that is when you get drugs that have extremely high dosages and are manufactured incorrectly.
So, why is it especially dangerous for teens? We've all seen in movies and TV shows that high school is a time where teens start experimenting with and getting exposed to substances. So, the reason why we want to guide you guys to a clean teen lifestyle is because substances like alcohol, marijuana, and painkillers can be laced with a synthetic opioid called fentanyl. Now, what's so dangerous about this opioid is that many people are unaware of when they are actually consuming it. Fentanyl can be disguised as a harmless pill or a drink that your friend may want you to try at a party.
But an amount of fentanyl as tiny as 3 grains of salt can be enough to kill. This is why it is so important to steer away from any substances, including alcohol, marijuana, and vapes, and maintain a clean lifestyle.
Students, especially people my age, are either pressured to use drugs or use them as an outlet for relieving anxiety and stress. Now, you are all young and bright students, and I urge you to consider the unchangeable effects of using opioids and other drugs. So I'll ask you, is it worth it? Is just trying it for fun really worth a life altering or life ending experience? The answer is no. It is never worth your life. So if you're ever at a party and someone, even if they're one of your closest and most trusted friends, offers you a pill, just say no. Now, we said in the beginning of this presentation that 1 in 7 teenagers abuse prescription opioids. When you see yourself 5 or 6 years from now, I hope you all see a happy and healthy teenager. Don't let that 1 in 7 be you. Beat the statistics and be the end of this opioid epidemic.
We are proud to be clean teens, and we hope that you can all pledge to be clean teens too. Are there any questions? And now we will move on to our quiz, and we have these 5 short questions. So, thank you all so much for listening.
Thank you so much.